Lyme disease is a vector infection, the most commonly reported vector-borne illness in the United States that affects an estimated 300,000 people in the United States each year, primarily in the Northeast and Upper Midwest within 14 states, accounting for over 96% of cases reported to CDC. Total 248,000 Lyme disease cases were reported to CDC by health departments in the 50 states, the District of Columbia, and U.S. territories between 1992 to 2006. Incidence was highest among children aged 5 to 14 years, and 53% of all reported cases occurred among males. At least 5 to 15% of patients with Lyme disease develop post-treatment Lyme syndrome, debilitating residual symptoms that last months to years even after having received antibiotic treatment. Often, patients with PTLS experience chronic pain in their muscles or joints or nerves. When Lyme disease is diagnosed early and treated promptly, patients usually get well. Yet the disease has sparked huge controversy over the decades because so many delayed diagnoses have left patients very ill. When diagnosis is delayed, patients miss out on early treatment. The result can be devastating. The problem stems in large part from the fact that in most patient diagnosis tests fail to pick up early disease. Lyme disease patients are commonly misdiagnosed with other diseases. According to a nationwide survey, LymeDisease.org, only 7% of chronic Lyme patients are diagnosed and treated within critical 30-day window essential to cure. More than half wait 2 years or more for correct diagnosis. The survey also confirmed that current methods used to diagnose and treat Lyme disease are often faulty and inadequate. Misdiagnosis of chronic Lyme disease can cause delays in diagnosis and treatment for actual condition and can cause harm to the individuals. All this opens the door for infection to advance to late-stage disease before it is ever detected. And some 20% of late-stage Lyme disease patients routinely fail standard antibiotic treatment, a finding consistently reported to the FDA review. With at least 300,000 new cases of Lyme disease a year in the United States alone, according to the Center for Disease Control and Prevention, half the number of patients are falling through the diagnostic crack, becoming strikingly and desperately sick. More research requires on this disease to achieve long-term goal to reduce the number of patients who develop symptoms of chronic Lyme disease by identifying better tests and by understanding the immunologic, rheumatologic, and neurologic impact of the illness over time. This can only be done by doing more research on this disease.